And joining us now to discuss former President Biden's diagnosis is Dr. Siavash Javari with Sharp Memorial Hospital. Thank you for joining us to discuss this concerning diagnosis and what it could mean for the former president. So many thoughts going out for him today. And we know the cancer is described as aggressive. President Biden already having urinary symptoms. It has spread to the bones. Let's start there. Explain to us how the cancer is determined as aggressive versus just undiagnosed for a period of time?
Sure. Thank you for having me. So prostate cancer in general can come in many different forms and varieties of aggressiveness. In fact, fortunately, most prostate cancers are very indolent and non-aggressive, and the majority actually never cause problems for people. But unfortunately, some do spread and or cause local problems in the prostate, and those cancers certainly need to be dealt with. And this sort of a presentation when prostate cancer spreads to the bones and or causes urinary problems, for example, is not atypical for those kinds of more aggressive prostate cancers.
What are the treatments and the prospects for prostate cancer already in the bone?
Sure. So, fortunately, there are a number of very effective treatments. When I meet patients in this situation, I have an honest conversation with them and their families, and I do tell them that, look, this is not necessarily a curable situation, but it is very treatable. And even prostate cancers that have spread, for the most part, can achieve remission for a number of years with the right treatment, and people can actually have pretty healthy and reasonably functional life for a number of years. So it turns into more of a chronic illness, at least for some time, that can be certainly treated and managed.
When we're talking about a former president, we know they're examined regularly. Isn't it pretty rare for a man to be diagnosed with prostate cancer that's already metastatic if he's having regular medical care?
Yeah, that's a really good question, and that's part of the nuance and controversy that we've seen over the last decade or so. So back when I trained in residency, it was pretty standard to do at least annual screening with blood tests with PSAs for prostate cancer. But even back then, we tended to maybe stop screening at a certain age. And then there was some concern about overdiagnosis and overtreatment, and there was some guidance from the experts to maybe screen less and maybe stop screening perhaps at earlier ages. And so, unfortunately, it's not super uncommon for us to see this where, because of a patient's advanced age, screening has stopped, which is typically appropriate for the majority of patients. But unfortunately, on some occasions, that does lead to some cancers that go undetected for some time, and then if they become aggressive and grow fast, they can sort of result in this situation.
A lot of talk about that. Is the age 70 where they don't suggest as much screening, and perhaps there is talk today the president of recent years, since 2021 at least, may not have had those PSA blood tests?
Yeah, that's my understanding as well. And this is where having an individualized discussion with your own physician becomes so important, because obviously a given binary arbitrary number is not necessarily the right answer for everyone. I think, patient preference, their goals, their tolerance for some risk, and also their overall health and longevity expectations really should go into that collective discussion that the patient and their family potentially has with their physician and making this decision together.
And as you look at this, the former president apparently didn't have urinary system issues until just recently. But do you think he perhaps had this cancer for quite a long time?
Almost certainly. What we know about prostate cancer is that, again, for the most part, it tends to be a relatively slow-growing cancer, and for the most part, you can have, the beginnings of abnormal cells and precancerous and then cancerous tissue for many years, if not decades. However, some of these cancers, unfortunately, after enough time, they accumulate enough mutations and abnormalities in their genetics that all of a sudden can hit an inflection point, and then obviously their growth curve and aggressiveness can accelerate. And so this story of, not having symptoms for quite a while and then all of a sudden developing symptoms rapidly sort of goes hand in hand with that, and we do see that on occasion.
And you and I already discussing our thoughts going out to the former president and his family today in this very serious situation. But Dr. Siavash Javari from Sharp Hospital, we really appreciate your expertise on this issue today.
Thank you.
Thank you.